Welcome to the podcast. My name is Dr. Noor Gajraj. Let's do a head-to-head on intermittent fasting and calorie restriction. Well, both calorie restriction and intermittent fasting are dietary strategies that involve reducing overall calorie intake, and both have been associated with various health benefits. While they share similarities, they differ in their approach. Calorie restriction. Calorie restriction involves consistently reducing your average daily caloric intake below what is typical without leading to malnutrition or deprivation of essential nutrients. This means eating less overall each day. Benefits of calorie restriction. Weight and fat loss. It directly leads to a calorie deficit, promoting the use of stored fat for energy. Improved metabolic health, enhances insulin sensitivity, lowers blood pressure, and reduces cholesterol levels, decreasing the risk of type 2 diabetes and cardiovascular disease. Reduced inflammation. It can downregulate inflammatory genes, leading to lower overall body inflammation. Enhanced cellular health and longevity. Research suggests caloric restriction can delay age-related diseases, improve immune function, and potentially slow biological aging. Preservation of muscle strength. It may improve muscle-specific force, meaning remaining muscle can generate more force per unit of mass. Understanding intermittent fasting. Intermittent fasting focuses on when you eat rather than strictly how much you eat every day. It involves cycling between periods of eating and voluntary fasting or severely restricted calorie intake. Common methods include time-restricted eating, eating within a specific daily window, for example, 8 hours. Alternate day fasting, normal eating one day, severely restricted calories fasting the next. 5-2 diet, normal eating for 5 days, significant calorie restriction on two non-consecutive days. 4-3, normal eating for 4 days, significant calorie restriction on three non-consecutive days. Benefits of intermittent fasting. Weight and fat loss creates a net calorie deficit over time, leading to weight and fat loss, often comparable to calorie restriction. Metabolic switch and fat burning. Fasting periods can trigger a metabolic switch. This refers to the body's shift from primarily using glucose from carbohydrates as its main fuel source to burning stored fat and producing ketones for energy. Improved metabolic markers. Similar to caloric restriction, it can enhance insulin sensitivity, reduce blood pressure, and positively affect cholesterol. Cellular repair and autophagy. Fasting activates autophagy, a process where cells clean out damaged components. Reduced inflammation. It contributes to suppressing overall body inflammation. Simplicity and adherence. For some, intermittent fasting can be easier to stick to than daily calorie counting, potentially leading to better long-term sustainability. Key differences, mechanism of action. While both strategies reduce calories, their underlying mechanisms differ. Calorie restriction primarily works by creating a consistent daily energy deficit, directly reducing the total energy consumed over time. Intermittent fasting works by leveraging periods of energy deprivation to induce metabolic shifts. There are cellular adaptations like autophagy. flexibility, and adherence. Choosing between caloric restriction and intermittent fasting often comes down to personal preference and lifestyle. Calorie restriction requires consistent daily tracking and discipline, which can be challenging for some individuals to maintain long term. Intermittent fasting offers various protocols, potentially providing more flexibility and making it easier for some to incorporate it into their lives as it focuses on when to eat rather than precise daily calorie counting. However, adherence can still be a challenge for both. Comparing effectiveness, weight loss, and cardiometabolic health. Recent research indicates both intermittent fasting and calorie restriction are effective for weight loss by creating a calorie deficit. Long-term weight loss results are often similar. Short-term nuances. Some intermittent fasting protocols, particularly alternate day fasting, might show slightly greater short-term weight loss than calorie restriction, but these differences are often considered trivial. Cardiometabolic markers. Both strategies offer similar benefits in improving cardiometabolic risk factors compared to unrestricted eating. Alternate day fasting in some studies showed additional minor improvements in body composition and lipid markers compared to calorie restriction. The most crucial factor for successful and sustainable weight loss is consistent adherence to the chosen dietary plan. Conclusion, choosing your path. Both calorie restriction and intermittent fasting are viable and effective strategies for weight management and improving various health markers, largely because they both lead to a reduction in overall calorie intake. The best approach is highly individual, depending on your preferences, lifestyle, and health goals. Always ensure adequate nutrient intake and consult a healthcare professional before making significant dietary changes. Well, thanks for listening. Please consider buying my book, 100 Pathways to Longevity, and subscribing to the channel. Thank you again.